You take an oath, and not an oath for money. You take an oath for safety. You take an oath for good patient care.
From the night team, nurses raising red flags about severe staffing shortages, saying they're already seeing the impact it's having on patients who are experiencing treatment delays as staff works to balance a much and higher needed than recommended patient load. Team 12's Bianca Bono spoke to two nurses about what they believe needs to be done.
I mean, you take an oath.
And due to staffing shortages in hospitals, these Valley nurses feel like they're breaking it.
It's hard to meet those demands, physically, mentally, and emotionally.
Jaretta Drasitis and Linda Campos describe a dire situation, saying they're often caring for more than 6 patients at a time, spreading themselves too thin, but left with no other option.
There comes a point where I need help.
On top of increased sick calls and an unprecedented demand for care, Drasitis and Campos say they've watched colleagues leave the industry for a number of reasons, including extreme burnout and recently due to vaccine mandates. Earlier this month, Mayo Clinic firing 700 employees who refused the vaccine, including at its Phoenix campus. Valleywise telling 12 News it had vacancies for 470 full-time nursing positions in 2021. Honor Health acknowledging it had a higher turnover rate in general over the past year.
You're taught in nursing to prioritize everything from most urgent to least urgent, and then you're like, okay, I'm gonna do this. And as the day unfolds, it's just chaos.
And they're not alone. In December, a group of healthcare workers writing a letter to state leaders warning of the impending crisis, the shortages having an immediate impact on patients.
Recently, we have had to temporarily close some of our urgent care locations due to staff availability.
In the letter, the groups call for hazard pay, something that was discussed at the federal level early on in the pandemic, but never came to fruition. Campos and Drasitis say bonuses are being offered to nurses who take extra shifts, but want hospital groups to focus on rebuilding its core staff. Fearful if more healthcare workers aren't hired, the system could collapse.
You take an oath, and not an oath for money. You take an oath for safety. You take an oath for good patient care.
And the federal government says all healthcare workers must be fully vaccinated by March 15th, so experts are bracing for the staffing crisis to worsen. Bianca Bono, 12 News.